Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to all participants. First of all, I would like to thank the organizer of 10 Malaysian Hybrid Conference on Healthy Aging for inviting me today. I'm Nurul Afiqah binti Aman, lecturer of Perdana University School of Occupational Therapy. For today, I'll talk about the topics on assessing cognitive development in children. Okay, before we go further into the cognitive development of the children, let me give you the definitions of cognitions. Okay, so according to the American Psychological Association, cognition is a term referring to the mental processes involved in gaining knowledge and comprehension. Some of the many different cognitive processes include thinking, knowing, remembering, judging, and problem solving. So this is the stages of cognitive development based on the Piaget's theory. Okay, so the first one is the sensory motor from birth to 2 years old. Okay, next one is the pre-operational stage. It started at 2 years old to 7 years old. And the third one is concrete operational from 7 to 11 years old. And the last one, or the advanced stage of cognitive development, is the formal operational started from 11 to 15 years old. Okay, so from the sensory motor stage, okay, so the infants will start to know the world through their movements and sensation. They start to explore the surroundings. They start to learn and receive input from the surroundings. Okay, integrate the input, integrate all the senses that they receive, and are able to understand their environment or their surroundings. Okay, at this stage, the sensors and also the sensory system play an important role for the child to learn about their environment, to learn about their surroundings. Okay, so from what they see, from what they hear, from what they taste, okay, from what they smell, okay, they will integrate all those senses, all the input, and they will learn about the surroundings or about their environment. Next one is the pre-operational stage. Okay, so the children begin to think symbolically and learn to use words and pictures to represent objects. They start to learn the use of the objects, the function of the object. Okay, they start to imitate adults when the adults use the objects, or when the adults use the things. Okay, so they start to imitate and they start to learn on how to use the objects. Next one is the concrete operational stage. Okay, so during this stage, children begin to think logically about the concrete events. Okay, they start to learn the consequences from their actions. Okay, they start to learn what will happen if they did a certain kind of actions. Okay, and the last one, or the advanced stage, is the formal operational stage. Okay, in which at this stage, the adolescents or young adult begins to think abstractly and reason about hypothetical problems. Okay, they start to solve their own problems. They start to find the reasoning, okay, about what happens, about their surroundings. Okay, so they have this kind of thinking. Okay, in the early intervention program, okay, so as an occupational therapy, we will receive a lot of children's conditions or children's diagnosis that we will need to assess their cognitive level. Okay, so if you notice, some of the children will respond when you call on them. Okay, they will respond directly when we call their name. Okay, but some of the children will respond only while you are providing the instructions. Okay, while you are explaining about the activities, they will only respond during that time. Okay, why this kind of situation happen? Okay, and another situation is some children learn the skills we teach in the regular classrooms. Okay, they are able to catch up easily. They are able to learn what we teach and able to understand what we teach in the regular classroom. But in the certain children, or in some children, they require additional specialized instructions. They require simple instructions. They require visual assistance instructions or visual instructions. Okay, so why these kind of situations happen? So these are related to their cognitive development and also cognitive skills. Okay, so next one is the information processing. Okay, so in this information processing, they are involved and involving the cognitive components. Okay, so the children will receive information from the environment. It will also involve their sensory and perceptual processes, memory, thinking, and language. Okay, so these are the five or the main components of cognitive processes. Okay, so for the child to have a good cognitive level or cognitive skills, they need to have this or they need to master these five components. Okay, so the first one is memory. The second one is sensory input motor actions. The third one is visual perception. The fourth one is language. And the fifth one is attention or executive functions. Okay, so this is the sensory motor functions. Okay, so as we all know, the stages of cognitive development is started from the sensory functions. Okay, so the child will learn a lot and will learn about their environments based on the sensory input that they receive. Okay, so it is important for the child to have a good sensory functions and a good sensory processing, okay, for them to have a good cognitive skills. Okay, so if they are being referred to occupational therapists, we will focusing more on sensory input or sensory functions first if we find out that they have the sensory issues, okay, before we proceed to the advanced cognitive skills. Okay, next one is the attention. Okay, so we have a few types of attentions in which it is important for the child to master or to have in order to function in their schools or academic field. Okay, so these are the component that the OT will look into when we assessing the children. Okay, so we will observe the child, either the child able to shift attention from one activity to another activity, the child able to selectively attend certain stimuli while ignoring the other irrelevant stimuli, or does the child able to sustain attentional focus for a prolonged period and also responds to more than one task simultaneously, or what we call divided attentions. Okay, so for the child to have a good cognitive development or cognitive skills, okay, attention is one of the important components. Okay, so this is the types of attentions that the child should master or should have. Okay, so the first one is the sustained attentions. Okay, so sustained attention is the ability to attend to one activity over a long period of time. Okay, for example, we want the child to complete the puzzles. Okay, and the puzzles will be completed in 5 minutes. So, does the child able to complete the puzzle in 5 minutes or not? Okay, so if the child able to complete the puzzles in 5 minutes, then the child have a good sustained attentions. Okay, and this sustained attention will be increased based on their age. Okay, next one is the selective attentions. Okay, so this is the ability to attend a specific activity in the presence of other distracting stimuli. Okay, for example, the child wants to read a book in a classroom. Okay, but at the same time, the classmates are talking to each other and making a noise. Okay, so if the child able to read the book in the distracting environment or in a noisy environment, so this child have a able to select their attention. Okay, so next one is the divided attentions. Okay, so divided attention is the ability to attend different attention at the same time. Okay, so for example, they are walking for their lunch and they are talking to each other. Okay, so they need to talk and they need to listen to their friends while walking. Okay, so this is the divided attention. Okay, and the last one is the shifting attentions. Okay, and this shifting attention is the ability to change focus attention between two or more stimuli. Okay, for example, the childs are doing or making a cupcakes, okay, in the kitchens. Okay, they are reading the recipes and as well as conducting the or doing the the instructions. Okay, so this is the shifting attentions. Okay, they read the recipes and they are also the next one, they are doing the steps. Okay, so these are the shifting attention. Okay, so this is the components in visual perceptual skills. Okay, there are 5 components. Okay, so the first one is the form constancy. Okay, so form constancy is the ability of the child to recognize the object, okay, in a different shape or in a different form. Okay, so the child should know that the object are the same, even the size are different. They are in different colors. They are in different positions. Okay, so this is the form constancy. Next one is the visual discriminations. Okay, it is the ability of the child to differentiate the two objects. Okay, either the size or either the colors. Okay, so the child is able to discriminate. Next one is the visual memory. Okay, it is the ability of the child to retrieve the visual informations. Okay, what they see, what they observe. Okay, so this is the visual memory. Next one is the figure ground. Okay, so the figure ground is the ability of the child to pick up objects in a messy backgrounds. Okay, or in a messy drawer, for example. Okay, you want the child to find an eraser in a stationary drawer. Okay, so figure ground is the ability of the child to pick up the things in the messy background. Okay, so next one is the visual closure. Okay, so the visual closure is the ability of the child to identify the pictures or the object, even if half of the objects are missing. Okay, even if we present with the half circles, okay, they should know that it is a circle, for example. Okay. Okay, next one in the cognitive skills or cognitive processes component is the language. Okay, so it is important for the child to have a language skills. Okay, they need to have a receptive language and also the expressive language. Okay, so for the receptive language, okay, the children must understand words and sentences to perceive and process informations. Okay, they need to understand the sentence, the words that being said by others. Okay, while for the expressive, the children must use words to show they can retrieve information from memory. Okay, they can express their memory. Okay, they are able to say what they hear, or they can say what they observe or see. Okay, so this is the receptive vocabulary. Okay, for example, at the age of 2 to 7 years old. Okay, so these are one of the things, one of the activities that we can do to the child. Okay, for example, we ask them to show me your eyes. Okay, so when the child hear that that sentence, okay, they should automatically show or point to their eyes. Okay, so this is the receptive vocabulary. Okay, so we know that either the child's able to understand what we say or not. Okay, next one is the expressive language. Okay, so for this expressive language, we ask the child, what is this? Okay, we show a picture to the child and ask them, what is this? Okay, so they should be able to name it. Okay. Okay, next one is the memory components. Okay, so the children are expected to learn and remember, especially in classroom. Of course, when they learn and they are sitting in a classroom, they will learn and need to remember information. Okay, so the information is presented either visually or verbally or both. Okay, so some of the information is new and some of the informations are from the previously acquired knowledge. Okay, so they need to retrieve it. Okay, so these are the types of memory. Okay, so the first one is the sensory memory. Okay, so it involves attention and perception. Okay, so the storing of this information from senses are only up to 3 seconds. Okay, so they see the objects and they remember. Okay, then after that it will be transferred to short-term memory. Okay, so the data will be stored temporarily around 2 to 30 seconds. Okay, and at the average of 7 items. Okay, so for example, if we are remembering the seven numbers, okay, so that memory will be stored temporarily. Okay, if we doesn't repeatedly memorize, okay, it will only store for 2 to 30 seconds. Okay, and the last one is the long-term memory. Okay, and then this information will be transferred to the long-term memory, and it is the ability to store for a lifetime. Okay, this is where all of our memories are being stored, and the capacity of this long-term memory are immeasurably large. Okay, so the capacity is unknown. Okay, so far we live for 30 years, for 40 years, for 50 years. Okay, all of our memories are being stored there in the long-term memory system. Okay, so it is either we are able to retrieve it or not. Okay, so that's all for the cognitive components that occupational therapists will look into when we assessing the cognitive skills of the children. Okay, we will assess their memory, language, okay, their attention skills. Okay, so these are the components that we will look into to determine the cognitive level of the children. Okay, that's all from me. Thank you.